Hello, everyone. Today, we're here to discuss a crucial topic that affects healthcare workers and others who handle needles and sharps in their line of work: occupational needle stick prevention and safety. The most common occupational hazards for clinicians, including a significant portion of the VDH workforce, involve exposure to needles and other sharp objects. Needle sticks and splashes to the eyes are consistently identified as primary causes of occupational bloodborne pathogen exposures. Among these, needle sticks pose the greatest risk for transmitting bloodborne pathogens. In this presentation, we'll cover key aspects of needle stick prevention, including who is at risk, activities associated with needle sticks, the importance of the Needle Stick Safety and Prevention Act, types of engineering controls and safety devices, and best practices for safe needle disposal and handling. Let's begin by understanding the risks associated with needle stick injuries and the measures we can take to prevent them. A needle stick injury occurs when the skin is penetrated by a contaminated needle or sharp object, potentially exposing the individual to bloodborne pathogens like HIV, hepatitis B, or C. It's important to note that while needle stick injuries are always considered injuries, they do not always result in exposure to bloodborne pathogens. However, since needles are often contaminated, these injuries still pose a significant risk and require careful attention. Who is at risk for needle stick injuries? Anyone with potential exposure to needles and sharps is at risk for needle stick injuries, including healthcare workers, contractors, part-time students, part-time workers, interns, and volunteers. Needle stick injuries can occur in various roles beyond direct patient care, such as dentists, dental hygienists, phlebotomists, lab techs, and maintenance workers. Reporting and management of needle stick injuries may vary based on the individual's role within the organization, but the consideration for potential risk should be consistent across all positions. Activities associated with needle stick injuries in the past 3 years include improper technique, such as not using the correct needle, not using safety devices correctly, and not following the correct procedures. Recapping needles still accounts for roughly 5% of needle stick injuries annually, according to the CDC. Proper technique is crucial and includes how procedures are administered, correct use of needles, and proper use of safety devices. Improper technique leading to needle sticks can be caused by factors such as bumping into coworkers, inadequate training, and by working too quickly. Why is needle stick safety important? Annually, an estimated 385,000 sharp injuries happen annually in the United States. The WHO estimates 3 million bloodborne pathogen exposures occur annually based on only reported needle sticks. The American Nurses Association estimates that 1 in every 5 healthcare workers sustains a needle stick injury yearly. Various factors affect the risk of exposure, including the source patient's blood, the road of entry, and the device used. The risk of seroconversion from a positive source is 6 to 30% for HBV, 2% for HCV, and 0.3% for HIV, with hollow bore needle sticks posing the greatest risk. Needle stick injuries incur costs such as testing, treatment, follow-ups, and loss of productivity. The emotional toll, including fear and anxiety, is immeasurable. The biggest reason from an occupational health and safety standpoint as to why needle stick safety is important is because they are preventable. The Needle Stick Safety and Prevention Act, enacted on November 6, 2000, called for the revision of the OSHA standard regulating occupational exposures to bloodborne pathogens. The revised OSHA standard, effective in April of 2001, mandated several requirements. Exposure control plans should be incorporated, and they should incorporate advances in technology for safer medical devices to prevent bloodborne pathogen exposures. Annual documentation of review of commercially available medical devices designed to prevent bloodborne pathogen exposures. Input from non-managerial staff with direct care in the identification, evaluation, and selection of effective engineering and practice controls, maintenance of a Sharps injury log to track trends and implement better controls for protecting workers. Compliance with the Needlestick Safety and Prevention Act involves incorporating changes in technology into exposure control plans to prevent needle sticks, involving non-managerial staff in selecting safer needle devices and maintaining a Sharps injury log to monitor trends in injuries. 2020 marked the 20th anniversary of the Needlestick Safety and Prevention Act. The International Safety Center created a flyer in 2020 to raise awareness about needle stick injuries using reported EpiNet data. While there was a decline in needle stick injuries in the first 10 years after the act was passed, the last decade has not shown the same decline. National data for 2020, 2021, and 2022 was reviewed, comparing it with some of BDH's reported data on needle stick injuries. Nurses were found to be most affected by needle stick injuries, with sutures being the most common device involved, followed by disposable needles and blood collection needles. Continued attention to needle stick safety and prevention is emphasized, particularly focusing on preventing injuries among nurses and physicians. Based on the information provided, the EpiNet report for needle stick and sharp object injuries for the reported period of January 1 to December 31, 2020, highlighted the need for continued attention to needle stick safety and prevention. Despite efforts, there hasn't been a decline or continuation of declines in needle stick injuries, emphasizing the importance of maintaining awareness and vigilance in this area. The report noted that most needle stick injuries occurred with nurses and sutures being the number one causative device, followed by disposable needles. This data underscores the importance of considering prevention strategies such as training on safe handling and disposal of sharps, using safer medical devices, and implementing engineering controls to reduce the risk of needle stick injuries among healthcare workers. Continued efforts in surveillance, reporting, and analysis of needle stick injuries are essential to identify trends, implement targeted prevention strategies, and ultimately reduce the incidence of these preventable injuries. Nurses in 2020 received 36.3% of all the needle sticks that occurred. Doctors also have a high percentage, but what I want you to notice on the screen is that there are 22 positions and not all of them are in direct patient care, but we want to include all staff that encounter needles. In 2020, needle sticks accounted for 53.8% of reported Sharps injuries, and this trend continued in 21 and 22, with both years of Sharps injury reports hovering around 50%. A report from EpiNet in 2020 shows that disposable syringes were the most common device causing needle stick injuries, accounting for 16.7% of cases, followed by sutures at 23.7%. The data emphasizes the need to focus on all types of needles, not just disposable syringes, as they collectively contribute to a significant portion of Sharps injuries. The data breaks down the type of disposable needles used, with the majority of injuries caused by 24 to 25 gauge needles. A survey of nurses in the Eastern region revealed that the most commonly used needle in their inventory was 25 gauge. Not all types of needles have a safety device, but when present, in almost 67% of those cases, the safety mechanism was not activated. Activation of the safety mechanism reduces injuries significantly, with 53% of injuries occurring before activation of that safety device, 31% of the injuries occurred during the activation, and only 13% of injuries occurred after activation of the safety device. Needle stick injuries often occur during or before activation of the safety needle, but sometimes injury occurs after the safety activation, highlighting the importance of safe practices during use and needle disposal. Nearly 21% of reported needle stick injuries occurred to individuals who were not the original users of the device. This data underscores the importance of considering needle stick prevention not only for the user, but also for others who may come into contact with the device. Prevention efforts should address the broader context of needle use and disposal to protect all individuals who may encounter needles. As we look at this graph, VDH Sharp's injury from 2020 to 2022, we can see that there's been a decline in needle sticks over the last 3 years. In 2020, there were 16 total sharp injuries reported, with 6 resulting from needle sticks. In 2021, there were 13 total sharp injuries, with 9 from needle sticks. And in 2022, there were 9 total sharp injuries, with 7 from needle sticks. The data includes injuries across all VDH staff, including those from autopsies, the medical examiner's office, and testing animal sources for rabies. VDH sharp injuries in 2020 through 2022. Over the 3-year period, most needle stick injuries at VDH occurred among nurses. The most commonly involved device was a disposable needle, often during vaccine administration. The data aligns with national trends, indicating areas for improvement in preventing needle stick injuries. The positive trend of declining needle stick injuries is encouraging, suggesting potential improvements in safety practices. The goal is to prevent all needle stick injuries. Various strategies can be explored to reduce the risk and avoid needle sticks, with reporting and injury logs being valuable tools to aid in this effort. But how? By following the safety hierarchy of controls. Elimination, physically removing the hazard. This can involve eliminating the use of needles and other sharps. Substitution, replace the hazard. Use alternate routes of vaccine and medication administration. Engineering controls, isolate people from the hazard. This includes using engineered safety devices on needles. Administrative controls, change the way people work. This can include using a neutral zone to avoid hand-to-hand passing of needles or prohibiting recapping of needles. And PPE, protect the worker with personal protective equipment. While important, PPE should not be the primary method of protection. It should only be used in conjunction with other higher priority controls. Engineering safety devices for needles are specialized devices designed to enhance safety when using needles, particularly to prevent needle stick injuries. So, engineering controls equals engineered safety devices. These devices are engineered to reduce the risk of accidental needle sticks by enclosing, covering, or retracting the needle after use. They're part of the broader category of engineering controls, which aim to eliminate or minimize workplace hazards through design modifications or technological interventions. Here we have the sheath models, which uses an extendable tube that is advanced over the needle, enclosing the needle, and the tube clicks and locks into place. So we have BD safety lock syringe at the top there, and they're manufactured by Becton Dickinson and Company, and the safety feature typically involves a sheath or shield that covers the needle, locking it in place and reducing the risk of accidental needle sticks. This is commonly used in healthcare settings to administer injections safely. The second set of pictures down from the top, monoject safety syringe. This type of a safety syringe is used for administering medications like insulin and tuberculin. The safety feature is activated with a 2-click system, once with activation of sliding sheath up, and 2 with locking it in place with a twist, ensuring that the needle is securely enclosed and cannot cause injury. This is commonly used in healthcare settings to ensure safe and effective medication administration. So the last set of pictures at the bottom is a Magellan safety syringe. This is a type of safety syringe designed for safe and easy use in healthcare settings, and it features one-handed operation, allowing the user to activate the safety mechanism with either their thumb or finger. The syringe is known for its user-friendly design and is often used to administer medications and vaccines safely. The considerations you must take here, just familiarize yourself with the safety mechanism on the syringe, and each manufacturer actually has a video on how to use that So you might want to look at that video prior to using the safety features on these syringes. And here we have the hinge models. The hinge model safety devices utilizes a hard cover that's pushed or flipped over the needle with one hand. Depending on the model, this can be done using a finger-thumb method or by using a hard surface to activate the safety. Hinge models are the most common and seem to be the most cost-effective and most versatile. Just like the sheath models, activation of the safety device is on the user's end, and all the models have an audible click to confirm the cover is locked in place over the needle. So here you have first set BD Safety Glide TB needle, designed for administering tuberculin skin tests. It features a shielding mechanism that covers the needle after use to reduce the risk of needle stick injuries. The second set of pictures from the top down, BD Eclipse Safety Needle. This is designed for various medical procedures, including injections and blood draws. It features a shielding mechanism that covers the needle after use to reduce the risk of needle stick injuries. And the third set of pictures down, BD Safety Glide Needle. This is designed for injections and blood draws. It features a shielding mechanism that covers the needle after use, helping to prevent accidental needle sticks. And the last set of pictures, fourth set down from the top, is a TKMD hypodermic safety needle. It's designed for injections, vaccinations, and blood draws. It features a retractable needle mechanism that's activated after use. It's very important to activate these safety mechanisms immediately. And if you're not sure how to work it, by all means, go to the manufacturer's website and check out their videos on how to use their safety devices. Retractable model safety devices shift the act of shielding the needle from the user to the device. The device uses a spring to either extend the sheath over the needle after injection or retract the needle back into the syringe. They typically activate when the plunger rod is pushed by the user. It acts on a spring that recoils. Some models have two methods of activation, one being after the injection is withdrawn from the patient, and the other is while the needle is still in the patient. The BD Integra is a good example of a model that can do both. The Vantage Point syringe, it features a retractable needle that automatically retracts into the syringe barrel after the injection is complete. This safety mechanism is activated by pressing a button or plunger, which causes the needle to retract safely and securely. Most of the retractable needles come attached to syringes or require you to purchase the corresponding needles and syringes for that particular model. Another engineering control that is part of needle stick safety is rigid sharps disposal containers. Consider the type you need, and you want to match the variety of sizes depending on the size of needle you use, and do you want it fixed or portable? Some key requirements include they are puncture resistant, leak resistant, closable, color coded, marked, and especially with a fill line, and disposable. OSHA requirements for rigid sharps disposal containers to ensure the safe disposal of sharps, such as needles, syringes, and lancets in healthcare and other settings. This includes requirements for the safe handling and disposal of sharps, which encompass the use of sharps disposal containers. Best and safe practices in administration controls for needle stick prevention involve implementing policies and procedures to reduce the risk of needle stick injuries. These practices focus on changing work practices and behaviors to minimize exposures to sharps. Some examples of safe practices include use of neutral zones, hand-to-hand passing, prohibition of recapping, safe disposal, proper training, use of personal protective equipment, and injury reporting and investigation. By implementing these best practices in administrative controls, healthcare facilities can help reduce the risk of needle stick injuries and create a safer environment for healthcare workers. Public health settings are not limited to our clinics, and sometimes we are called to work somewhere else on short or no notice. A lot of public health work is accomplished in community buildings, emergency sites, and patient homes. So, part of preventing needle sticks in the workplace is being prepared for changing workstations. When setting up a workstation, ensure you have all your equipment and it's within arm's reach and not in the line of someone else's workspace. Such is the case with the disposal container for needles. Location is key here. Research shows the closer the container is to the point of use, the lower the risk for injury, and you do not want to have to cross over someone else's workspace. Training on all specific needles is required. Managers, supervisors, leads, it's important that you know what equipment staff are using and are required to give prior training for this equipment. With emergencies comes an assortment of supplies. Trainings can be as simple as utilizing the needle informational pamphlet, manufacturers' websites, great resources for training videos and information, as we mentioned. YouTube is a great source, but confirm that that video is produced by the manufacturer of the needle, please. Just as it is important to prepare yourself for any procedure, it's just as important to prepare the patient, as this will help them anticipate what is happening, which can prevent sudden movements from occurring. It is also important to assess the patient's ability to cooperate. Is the patient confused, combative, or uncooperative? If so, you may need some assistance before you start taking care of the procedure. So you want to organize your workspace and equipment, know where the sharps disposal container is located, ensure you've been trained on the specific needle you're using, educate the patient on the procedure, assess patient's ability to cooperate, know local facilities policy for needle sticks. So now you want to be aware. Always have a visual on the needle you're using while also being aware of the location of your coworkers. Fingers should always be behind any sharp from the start all the way to disposal. Know where other workers are. Don't pass or transfer needles, sharps to another worker, and try not to have your back to the door. Best practice to have a neutral zone for passing or transferring a needle to another. Observe audible or visual cues for confirmation of safety device lock. Activate the safety device as soon as procedure is complete. So dispose with care. When disposing needles, maintain control of the needle and tubing, especially for needles with tubing like a butterfly needle, to prevent accidental dislodging or injuries. Always keep your fingers behind the needle tip and avoid putting hands into the sharps container. Additionally, ensure that all filled containers are securely stored for disposal and inspect the area to ensure no sharps are left behind, considering the safety of support staff as well as your own and others nearby. What if you do have a needle stick? Wash the area. Wash the needle stick site with soap and water as soon as possible. Seek medical attention. Report the incident to your supervisor or occupational health services immediately. They will assess the risk of infection and determine if a bloodborne pathogen exposure has occurred, and further medical evaluation or treatment is necessary. Identify the source. Try to identify the source patient if possible, as testing may be needed to determine if they have any infectious disease. Follow-up testing. Depending on the circumstances, you may need follow-up testing for infectious diseases such as HIV, Hep B, or C. This testing is typically done as a baseline and at intervals after the exposure to detect any infections. Report the incident. Follow your organization's protocol for reporting needle stick injuries. This helps in tracking and preventing future incidents. Follow-up care. Follow any additional instructions or recommendations from your healthcare provider or employee health services. It's important to remember that prompt action is key to reducing the risk of infection after a needle stick injury. Always follow your organization's policy and procedures regarding needle stick injuries. VDH has a bloodborne pathogen exposure guideline that will be available soon. This will give additional information for every district location's bloodborne pathogen exposure processes. So thank you for your time today, and I appreciate your attention. Have a wonderful day.